I know, this class, the Bio 2028. Yeah, so we are like every 3 times a week. It's quite a lot of pressure for you guys, but I can see a few students trying to come every day. That's a brilliant thing. So let's start blood. Blood is, I believe we know blood, what blood is. Blood is inside. But let's say if somebody asks you, hey, or your little sister or your friends who is doing arts, not doing science, and if they ask you, what is blood? What will you say? Okay, it's a little bit daunting, isn't it? So what do we say? Like, what is bone? What is the definition of bone? A bone is a specialized connective tissue, isn't it, which is made of cell and matrix. So that is a bone. Cartilage, what is cartilage? Cartilage is also a specialized connective tissue, which is made of cell and matrix. So how many connective tissues do we know? We know the areolar connective tissue or connective tissue proper. The bone is another type of connective tissue. Cartilage is another type of connective tissue. And number 4, blood. Yeah, blood is another type of connective tissue. So we're going to talk about blood today. So that we makes we sort out another type of connective tissue in our body. So what does it do, this blood in our circulation? What is it doing? Of course, it is at the capillary level, not a elastic artery, medium-sized muscular artery, or arterial level, not that level. But once we finish arterioles, then it will lead into the small capillaries. The size of the capillaries are about 8 to 10 micron. So at those capillaries level, it only works at those capillary levels. So the elastic artery, medium muscular artery, and arterioles, their job is to carry blood to those capillary level. So at the capillary level, the blood will give oxygen to the cell, and will take carbon dioxide back from the cell. So let's say if the blood is going to the lungs, at the lungs capillary level, the blood will take oxygen back from the lungs, from the inspired air, and we deliver carbon dioxide into the lungs alveoli for gaseous exchange. Nutrients, so those capillaries from the gastrointestinal tract, like these capillaries will absorb all the amino acids, fat, protein, everything, water. It will nutrients, it will take it back to the portal circulation. Hormones, you know about hormones already. So from one place, the blood will carry hormones and then deliver to another place. And it also contains immune cells. And from the cell, it will take back all the carbon dioxide and cell waste, metabolism of cell, all the waste from the cell. So it will take it back. And on top of that, the blood at capillaries level, it will play a role in the temperature regulation. Of course, these capillaries, you notice that, capillaries will dilate because of the pericyte relax or capillary constrict. And on top of that, the blood contributes to the temperature regulation as well. So a lot of blood come in, we transfer the heat. So just small little blood come in, we not transfer the heat that much, depending on the environmental temperatures. So it has got many functions. And so as we say, what is blood? Blood is a specialized connective tissue. What is the contents of blood in our body? So it is average is about 70 ml per kg body weight. So let's say if I am 70 kg body weight, then I will have about 4,900 ml. In other words, let's say about 5 liters of blood in our body. So depending on the body weight, so if a 100 kg person, 7,000 ml, so 7 liters. So yeah, so now you know what a blood is and how much blood do we have in our body. And we always say, you know, what is it? Definition. What is blood? Blood is connective tissue, which is made of connective tissue, always made of cell and matrix. Of course, blood is fluid, so its matrix is not solid, its matrix is fluid. And of course, cells. What are the cells in our blood? RBC, white and red blood cell, or in other words, erythrocyte. Cyte means cell, erythrocytes, white blood cell, WBC, and platelet. So, and fluid contributes about 55%, which is called plasma. Fluid portion of the blood is called plasma, and the cell portion is RBC, WBC, and platelet, which contributes about 45%. So yes, so fluid, so any fluid in our body, of course, is made of water, isn't it? So fluid, blood is made of water, 90% of that 55%. And you will see sodium, potassium, chloride, all the electrolytes. You will see nutrients like glucose, lipid, carbohydrate, fat, protein. Carbohydrate in the name of glucose, fat mean lipids, protein mean amino acids, all the vitamins you eat, all the waste from urea, ammonia, carbon dioxide, hormones, antibody, clotting factors is important. It's not platelet, it's clotting factor. Platelet is for bleeding, clotting factor is to cut clot. And of course, this is like amino acids in it, albumin, globulin, and fibrinogen. But we have separated these type of amino acids in a slightly different group because they have their own merits and they are important. And cell, RBC, WBC, and platelet. So let's go back to the previous slide. What is blood? Blood is a specialized connective tissue, not a random connective tissue. It is specialized connective tissue. And because you say connective tissue, which means it needs to have cell and matrix. You know that. So cell, in RBC, WBC, and platelet, and fluid portion is called plasma, which makes about 55%, and cell portion about 45%. And in the fluid, we need to know water is easy to remember, sodium, potassium, chloride, all the nutrition we eat, all the waste products from our body, hormone, antibody, clotting factors, and especially albumin, globulin, and fibrinogen. So what is the difference between plasma and serum? I believe, you know, some of you guys, you're working in some clinical environment, some might work in a hospital like phlebotomy. So what is the difference between plasma and serum? So serum is equivalent to plasma, but we have to remove the clotting factor. So this is the plasma. If we take out this clotting factor out, for the rest, we leave all the rest, but we take out the clotting factor, then that is called serum. Okay, so the job, we separated, you know, this albumin, globulin, fibrinogen, because they have like a very important function. Albumin is for oncotic pressure. Oncotic pressure means it's just keep the pressure inside the blood so that it try to keep all the water, it try to hold all the water. So which means if we have low albumin, the blood cannot contain water with it, and the blood will seep out into the surrounding cells at the capillaries level. So that is what we call edema. So low albumin level, patient can have edema, tissue edema. Edema is the presence of excess fluid around the cell, not in the cell, not intracellular space, in between the cells, interstitial space. And this oncotic pressure exerted by the albumin try to control all the fluid inside the vascular, intravascular oncotic pressure. It controls it. If there is low albumin, there is no more intravascular oncotic pressure, and then that 90% of water can leak out from the capillaries. And of course, globulin, you know that antibody transport lipid, iron, copper, and fibrinogen is for clotting function. So let's say if I take out somebody's blood, venous tourniquet, the veins become engorged because the blood cannot flow back to the heart, and then the veins engorge, stick a needle in, take some blood out, put it in the tube, and centrifuge it, put into the centrifuge, and this is what we are going to get. So if you are working in the laboratory, medical laboratory, you will see this every day. So what do we see with our naked eye easily? Is we only see two, like one big layer, which is called plasma, and one big layer, which is called cell. Cell and matrix. Matrix is fluid. That fluid is called plasma. But if you really look carefully, then there will be a very thin layer in between these two, cell and fluid. That is what we call Buffy coat. Yes, cells, which is made of, look at that, the red color. It is erythrocyte, our red blood cell. And that little coating layer in between two cells, it is also cell, which is made of white blood cell, leukocyte, and platelets, this Buffy coat. And plasma, of course, plasma is made of mainly water. And as you know, like all the carbohydrate, fat, amino acid, all the waste and everything here in plasma and clotting factors. So this diagram explains as what are the contents of the blood. The blood is a specialized connective tissue, which is made of cell and matrix. Cells are red blood cell, which is such a large amount, white blood cell and platelets, which is very small amount. You can see that if you look at carefully in the middle layer, and of course, plasma. So 55% plasma and 45% is cell, and that 45% is mainly made of the red blood cell. So the white blood cell and platelets, they are less than 1%. Therefore, when we say, hey, cell is about 45%, that 45% is mainly made of RBC. Because white blood cell and platelets are less than 1% of the whole blood. Yeah, so that is what we have here. So what is hematocrit? So hematocrit is the percentage of blood volume that consists of RBC, which is this one. This is the hematocrit. Hematocrit is the percentage, which is 45% of blood volume, percentage of blood volume, which is made of the RBC. Yeah. So if somebody has low hematocrit, means there is low RBC, which might indicate anemia. So anemia means low hemoglobin means low red blood cell. Low red blood cell means instead of 45%, it might be about 30%, which means hematocrit low, means that person has low RBC and anemia. So in men, generally 47 plus or minus 5%. In women, about 42. And babies, newborn means like from the time of birth up to 1 month. So that is what we call newborn. From 1 month to 1 year, it is called infant. Yeah, so first 1 month is called newborn, and newborn, they can be variable. It ranges from 42 to 68%. So I want you to pick up this definition. What is hematocrit? Hematocrit is the percentage of blood volume that consists of RBC. That is what they are talking about here. And what is plasma? What is serum? What is blood? So just pick up these little informations, these definitions, which will make it more meaningful, because that indicates we know what we are talking about. Because definitions are important. Like as you go along, with your career, everything you say, you need to know, and that is what we call definition, isn't it? Right. So what I would do is we take somebody's blood and take a drop of blood on the glass film. Put a drop of blood, and if we make it slide, then that's what we are going to do, is we are going to do a blood film. Yeah, so take a drop of blood from somebody, put it on the glass slide, just draw a film, and let it dry. Let's preserve with the methanol and AN acid, eosin, and basic methylene blue. Stain it. That is what we call dry stain. Now that's what we see in the blood film. So you put that blood film under the microscope after all these processes. Of course, depending on your laboratory, you have to do slightly different. Might have to use slightly different chemicals. So put it under the microscope. Now this is what you are going to see. So you are seeing lots and lots of red cells. Why are we seeing a lot of red cells? Can somebody tell me? So you can see this blue cells, not a lot, here and there, 1, 2, 3, 4, 5 in one picture, but you are seeing multiple red cells. Why is that?
Because the blood is mostly red blood cells.
Brilliant. Yeah, because it is cell, 45% of cell is nearly 45% is RBC. Because these cells, they are not red blood cell, they are white blood cell, and they are less than 1%. So you see 1,000, you might see like about 10. So you see 100, you might see about less than 1. So that is why once you look at the blood film, you are going to see RBC. So don't get surprised, don't get shocked when you have to look at the blood film, because RBC makes of 45% of, nearly 45% of 45% of cells. That is what you are going to see. And look at the shape of the RBC. It is rounded and circular with slightly pale, centrally pale area, because of the shape of the RBC, which we will talk about that later. So all the RBCs are circular and with centrally pale area, circular, centrally pale area. And there will be a few little different here, like a little crescent shape. What is that? It might be like hemolysis or something else, but not a lot. So it is only one. We can only see one in this multiple. So that is normal. Then look at that. These cells. So RBC, now we have a photographic memory, what an RBC is look like. And now let's look at the other cells other than RBC. Look at the difference here. So this cell is like a blue purple color, and its nucleus is fairly nearly whole cells. So that is, this guy is slightly different. And then look at this guy. This guy, the cytoplasm is blue or purple, and its nucleus is quite big, like a bean shape, kidney bean shape. If you eat kidney bean, that is what it is look like. I hope everyone has had kidney beans in your life. And this looks like a kidney bean with the purple blue color, and the cytoplasm is also slightly different. What about these cells here? This cytoplasm is very pink, very pink, very pink. You see that pink cytoplasm, and nucleus has got 3 lobes. Here only 1, here like a kidney bean, and here you can see 3 lobes of nucleus, 1, 2, 3. Look at this guy, the same things, they are pretty similar. And this cytoplasm is also pink, and this dark blue, black, purple color nucleus is like 1, 2, and 3. And look at this, its cytoplasm is red, and its nucleus is only 2, and it looks like an ET. So now you are seeing different cells. Of course, if it is not RBC, it can be WBC, white cell, or it can be platelets. Platelets are very small. So platelets are very small. So now here they have pointed out here, platelets are very small little chips of platelets here. So these are the white blood cells. So I believe you can see RBC, WBC, and platelet in this slide. Yeah, so this slide, you can see lots and lots of RBC, because RBC makes nearly 45% of cells. White blood cell, less than 1%, here, there, sparse here and there. And platelets, small little tiny chips. Here, there, not sure, it might be here another one, might be here another one, here another one. So these are the platelets, and the rest is white blood cell. And even in the white blood cells, you are now looking different types of white blood cell. Like this is purple color cytoplasm with deep purple color nucleus, one only single. And this is like a purple color cytoplasm, purple color nucleus, big kidney shape. Trilobe, 3 lobes, trilobe, 3 lobe with the pink cytoplasm, and 2 bilobe nucleus with the pink cytoplasm. So the way I try to remember is ET looks like ET, like I believe you guys have watched, ET cartoon or movies. So like here, and that is what we call eosinophil, E for E. Eosinophil is look like a ET. And this trilobe with the pink, they are neutrophil. You can see 2 neutrophils here in this blood film. And this purple color cytoplasm with deep purple color, big, only 1 and big, that is lymphocytes. And this kidney bean shape nucleus is monocyte. So, hey, is it important? Yes, it is important for the sake of anatomy class. I mean, when we finish this anatomy, you might want to forget about that. And I think this information will easily evaporate. But at the moment, it's important. And I think it is important for the life if you want to work in the laboratory, pathologist, if you want to be a pathologist or hematologist. So why are we seeing 2 neutrophils when we see only 1, 1, 1? What do you think? So in this blood film, we see a lot of RBC, And even for the WBC, how many WBC we see? 1, 2, 3, 4, 5. Among 5 WBC, we see two neutrophils. Why is that?
It's the most common.
Yeah, most numerous, most common of the white blood cell. That's why just make a one. Yeah, so you see this. Brilliant. So this is the most common, most prominent part of the WBC. So neutrophil, lymphocyte is like a only once, not, it's very big nucleus filling the whole cell. And monocyte is like a kidney bean, and ET for eosinophil, and neutrophil is trilobe, usually about 3 lobes, sometimes 4, sometimes they can go up to 5. And if you think you can see the nucleus of these white blood cells, and can you see nucleus in the RBC? No. Why is that? Because RBC do not have nucleus. RBC, red blood cell mean ideally a cell need to have organelles like mitochondria, nucleus, nucleolus. RBC, red blood cell, although we name them as a cell, they are not really a cell because they do not have organelles. We have to be careful when we say RBC, red blood cell, but actually it is not a cell because there is no organelles inside RBC. That's why you cannot see nucleus in the RBC. Because when they are babies, baby RBC, they still have nucleus. But when they become mature and come out into the circulation, they do not have any more nucleus. Therefore, if you are seeing multiple RBC with nucleus, that means you are seeing immature RBC in the circulation. Hey, something is not right. We need to be careful what is going on. So let's look at this blood film. So now in this blood film, so these are the RBCs, isn't it? You know that already. It is like a rounded structure with centrally pale area, rounded structure centrally. Yeah, but now what are you seeing quite a lot? What cells are you seeing most or many? You are seeing these purple color. What is it? Here.
The white blood cells.
Yeah, you are seeing a lot of white blood cells. So especially with, it looks like this, isn't it? Lymphocytes. It is not neutrophil. It is not ET, eosinophil. It is not like kidney bean. And you are seeing white blood cell. A lot of, usually, you know, like how many RBC do we have? We can't even count. Let's say about 300 RBC, you see one lymphocyte. Now you see like not that many, but you are seeing multiple white blood cells, which looks like lymphocyte. So a lot of lymphocytes in somebody's blood. That is what we call lymphocytic leukemia. So if somebody has got leukemia, I believe you know leukemia, yeah? The cancer of the blood cell, like leukemia, lymphoma. So because you are seeing too many lymphocytes, this is not right, because you have to see multiple RBC to see one lymphocyte. And now this is a lot of lymphocytes, which we call lymphocytosis. It could be just like lymphocytes, immune system is kicking off, or if you are seeing this too many times, hey, this could be leukemia, lymphocytic leukemia. So be watchful, because you are seeing too many white blood cells. Too many white blood cells mean a lot of WBC. This is not right. Okay, let's look at next blood film. So now, this is pretty normal, isn't it? Hey, this here, California, yes, CA. I'm just joking. CA, California. So look at that. These are the RBC. Yeah. But the error is here pointing this RBC. And look with this little one here, this circular structure, we said RBC is, there is clear center, but here, this in the clear center, we have another dot, dot, and dot. What is this sign called? You know that? You know that you see this every day? That is target, isn't it? Our target, you know, not supermarket. These are the targets. That's what we call target cells. So RBC have some problem now. The RBC, which is supposed to be circular and centrally pay area, now this RBC is showing multiple, 1, 2, 3, multiple target cells. So hey, target cell is, and this is called target, like the way we talk about our supermarket target. So these are the target cells. That is another problem with the RBC. So we only see one WBC. We cannot see any more WBC. So this blood picture looks quite normal with the WBC, but the problem is in RBC. And here, what do you think this is? This cell?
Is it a monocyte?
Yeah, I think so. Yeah, it is like 1 lobe, 2 lobe, 3 lobe, I think. The nucleus is dark purple and the cytoplasm is pink. So it could be, I think it could be neutrophil because monocyte is here, kidney shape. So I think it might be like that because cytoplasm is pink and nucleus is trilobe. Yeah,
It's hard to see the different lobes in there, in that picture.
That's
like,
true. That's true.
I don't see lobes.
You don't see lobe, yeah. So
I believe you, but I just I don't see it.
Yes, you are right to say that, you know, because yeah, I'm just trying to imagine it as well. But for it, like might be one here and there, like slightly twisted. But again, like it's not like a kidney bean. And the cytoplasm is red. Is it red? Yeah, it's pink or red here. So now I believe you know, you have seen a normal blood picture. If you look at a normal blood picture, you are going to see multiple red blood cell because red blood cell RBC makes nearly 45% of 45%, and less than 1% is WBC and platelet. Platelets now you can see here and there. Platelets is just a little dust, like being chipped away from a very big, like if you grate the cheese, you know, from the big piece of cheese, you just grate it and small little fragments come out. That is platelets. So platelet is again not a really cell like RBC. You will see lots and lots of RBC because which makes nearly 45% or 45%, and less than 1% you will see platelet and white blood cell. Among the white blood cell, you will see more neutrophil. Neutrophil, because neutrophil is the most common in the blood. The lymphocyte, monocyte, eosinophil, neutrophil, that is what you are going to see. That is a normal blood film. And then now you look at that and you are seeing a lot of lymphocyte. Hey, lymphocytosis. Is it just immune reaction kicking off, or is it a leukemia? So that's what we have to come in our mind. And not only the WBC can get problem, RBC can get problem as well, which is supposed to be circular with centrally pale area. Is now, look at that. There are little targets here and there, little targets here and there. This is the target sign, the target supermarket we talk about. So these are the target sign. So let's look under the electron microscope. And of course, you know, they have to stain these blood cells with the color dye. And that is what we see. Look at that RBC, like a little flat cell with the center dimple. And yeah, this is like a dish, like a car tire. And WBC, hey, it is nice and rounded. And platelets, look at the platelets. It's just, there's a little chips of tissue, like a grated cheese, a piece of cheese came out from big block of cheese. So these are the RBC, WBC, and platelets, which makes the cellular portion of our blood. So talk about RBC. RBC, red blood cell, it is a misnomer. It is not a really cell, because it doesn't have any nucleus. It doesn't have any organelles. Erythrocyte, the size of the RBC is 7 to 8 micrometer. So now if you go back to your capillary, the size of your capillary is just slightly smaller, might be slightly smaller, like 8 to 10 micrometer. So let's say if the RBC is going through the 8 micrometer capillary, it will be pretty tight, isn't it? What is it should have to just like change its position slightly to go through the 8 millimeter RBC into the 8 millimeter channel. It is biconcave. We have seen that because the proteins are in the periphery. It is deformable. So this RBC, if the size of RBC is 8, and if it is going through the 8 micrometer capillary, it has to deform, it has to change and twist its shape to go through the capillary. And it is also surrounded by plasma membrane. There is no nucleus, there is no organelles. And its cytoplasm contains hemoglobin. Hemoglobin, which means heme, and globin combination is called hemoglobin molecule. Oh, so inside the RBC, we will have hemoglobin molecule, and outside it will be surrounded by plasma membrane. Inside the cytoplasm, we do not have nucleus, no organelles. It is deformable. Its shape can change. It is a biconcave. Its size is 7 to 8 micrometer. Bang. So hey, this is biconcave. One cave here, another cave here. Concave on both sides. It is a circular structure on the other side. On the other view, central dimple here. Because why is that? Because its protein are placed in the periphery here, not in the center, proteins. What protein do they have? Hemoglobin. Heme and globin, hemoglobin. Globin is protein, so hemoglobin is protein. Hemoglobin is made of 2 beta change, 2 alpha change. So 1 beta change here, another beta change here, 1 alpha change here, another alpha change here. So if you are doing physiology, you will have to study about hemoglobin pretty much in detail, because hemoglobin, the structure and functions of hemoglobin is really important. But as an anatomy student, I want you to remember that 7 to 8 micrometer biconcave deformable, surrounded by plasma membrane. In the cytoplasm, no nucleus, no organelle other than hemoglobin. So this is hemoglobin, heme and globin. Heme, where is heme? Heme is here. Ion here. Ion in the center, surrounded by heme, and that will be entrapped with 1 beta change. Another beta change, heme and ion. So that is the structure of the hemoglobin. Yeah, so now you can see what is hemoglobin. It is not in the center, it sits in the periphery and like a donut ring. So RBC lifespan is about 120 days, which means like if a newly formed red blood cell come out into our circulation, it will stay with us for about might be 3, might be 4 months. Yeah, 3-4 months roughly. So RBC is quite a long lasting, stay in our body for like about 4 months. And it is a biconcave surface. So look at that. This biconcave surface increases surface area by 30%. Of course, if we go from here to there directly, this length is just here. But if we make it biconcave, just go there, come down here, go back again. So this concavity gives a larger surface area. It increased the surface area by 30%. No nucleus, no organelle, no mitochondria, nitrosamine, hemoglobin, generate energy anaerobically because it doesn't have mitochondria. So it has to generate energy anaerobically, and it carries oxygen, it carries carbon dioxide. The size of RBC, 75 micrometer, the thickness of RBC, 2.5, that is not important here, but 7.5 millimeter, it is something we should pick up as an anatomy student. And what about WBC? So we said, look at that, look at the previous. So these are the RBC, which is biconcave. You can see the concavity with like a donut. And WBC is more like a little ball, spherical structure. So WBC, white blood cell or leukocyte, white side cell. It is spherical in shape. It is a proper cell. It is a proper cell, so it has got organelles like mitochondria, it has nucleus, and nucleus is something you are seeing with the microscope, and depending on the size and shape and number of the nucleus, you are differentiating these cells. And its job is not inside the circulation. Its job is to leave the circulation, go to the periphery, and do the job as necessary. So it leaves the circulation and its action is outside the bloodstream. So usually what's happened is, let's say this is the blood vessel, capillary, and these are the lining cells, erythrocytes, and you remember the pericytes, which are lining outside the endothelial cells. The floating WBC, we have to go and adhere to the endothelial cell, adhesion, and gradually it changed like a podocyte, change like an amoeboid movement. It will gradually leave the circulation in between the endothelial cell and go to the tissue and go and attack the infiltrating organism, microorganisms. So that is WBC. So WBC, never let me eat banana. Yeah, never let monkeys eat banana. I think that is a good way to remember. So this tell you how many types of WBC we have in our body, and it goes from the most common to least common. So never let monkey eat banana. Never mean neutrophil. Let mean lymphocyte. Monkey, monocyte. Eat, eosinophil. Banana, be basophil. So if you look at the blood film, what you are going to see? You're going to see RBC. Other than RBC, you will see neutrophil because it is most common. And after neutrophil, you are going to see lymphocyte because this is the second most common. Number 3 is monkey and monocyte, eat, eosinophil, and banana. So if you do not see basophil, don't worry about that because basophil is the least common. Basophil is the least common blood cell in our body. Did we see any basophil here? No. Why is that? Because it is the least common. Among 5, we see 2. So that's 40%, 40% neutrophil. Yeah, neutrophil, because it is most common. You don't see basophil because it is the least common. So Now this blood film makes a little bit sense, and why we see this and what is the reason behind. So never leads monkey eat banana. So neutrophil, lymphocyte, monocyte, eosinophil, and basophil. So that is the way, you know, we can remember how many WBCs do we have in our body, and how do we, like, if as an academic person, how do we classify WBC, white blood cell? We can classify WBC as like granulocyte and agranulocyte. What does it mean, granulocyte or agranulocyte? Because granulocyte means there will be granules in the cytoplasm. Agranulocyte means there will be no granule, agranulocyte, in the cytoplasm of that WBC. And so, of course, you know, granulocytes, so they will have cytoplasmic granules, no cytoplasmic granules. Granulocytes are usually larger, and these granulocytes, they do not live as long as RBC. Of course, RBC is 120 days. That means 4 months. That's quite a lot. So now granulocytes, we have neutrophil, eosinophil, and basophil. Agranulocyte, there is no granule inside. Agranulocyte in the cytoplasm, they are lymphocyte and monocyte. So let's go and look back our very first slide again. So you see eosinophil. There are little dots here. There are little dots here and there, multiple. These are called granules. You look at the neutrophil. Inside the cytoplasm, there are multiple little dots here. Therefore, you say this is granulocyte. But if you look at that, hey, I can't even see the cytoplasm, but less imaging, there is no granules, because it is agranulocyte, and monocyte as well, the same thing, no granules inside the cytoplasm. So now we can see the granulocyte and agranulocyte, and depending on the order of the commonness, neutrophil is most common and basophil is least common. And let's go to the next slide. So cell component, RBC, WBC, and platelets. So look at that, platelets. Now we are looking the GST, are WBC, leukocytes. So in leukocytes, you will see more granulocyte, which is colored in blue color, deep blue color, and agranulocyte in the light blue color. Yeah, among the granulocyte, neutrophil is most common, 50 to 70%. That's why if you look at somebody's blood film result, like maybe your friend or your relative, if they do like complete blood count, CBC, yes, CBC, if they do CBC, look at the result. In the CBC, you will see like neutrophil 50%. So that is normal. Neutrophil 70%, that is normal. Because among the WBC, and the neutrophil is the most common, which makes the 50 to 70% of WBC. Never let lymphocyte, look at that, lymphocyte is about 25 to 45% here, this very pale blue. And then never let monkey for monocyte. Monocyte is 3 to 8%. Eosinophil 2 to 4%, and basophil is like less than 1% here, basophil. So what is these, are these percentage important? Not really, but I think it's good to know, you know, like among the white cell, neutrophil makes about 50 to 70% of the white blood cell. That is pretty cool knowledge. So now let's look at each and individual WBCs. Never let monkey eat banana. Yeah, never let monkey eat banana. So look at that. We know pretty much about these neutrophil already. Neutrophil might be 3 lobes. It can be 4 lobes, or it can even be 5 lobes, but usually 3. And if you, that is the nucleus. And if you look at the cytoplasm here, it is pink color, pink or red color cytoplasm. You have to see, you have to see granules here. Please forgive me if you cannot see, but I have to say there are granules here. Hey, everybody look at that. Here, there are granules here in the pink or red cytoplasm. This is granulocyte, and this granulocyte, you have 3 lobes, trilobe nucleus. That is the neutrophil, most common, 50 to 70% of the WBC. Look at ET, yeah, eosinophil. This is what I say, ET. So you will see a two big nucleus lobes connected with little, like wearing a sunglass. Any of you guys wear sunglasses? I believe you do. So if you wear a sunglass, you might look like that. So you might look like that, little sunglass here, and look at the cytoplasm. Hey, there are granules. I think it is a little bit more convincing. This is granulocyte, and cytoplasm is pink or red color. That is the granulocyte, yeah, and with the bilobe nucleus. That is what we call eosinophil. Look at the basophil. I mean, if you haven't seen a basophil in your blood film, doesn't matter because it is less than 1%. So you see 100 other cells, you might see 1, or you might not because it is less than 1. Maximum is 1%. So 100 to 1. So you might not see basophil as much. And look at the nucleus. Nucleus is here. It is like it's an irregular shape. It is nothing specific. And if you look at the cytoplasm, it is still pink because it is granulocyte. You can see little granules here and there, here and there. So this basophil has the less minimum characteristic. It is a characteristic cell. This is characteristic like a sunglass or ET, trilobe. So let's move on to lymphocyte. We know that lymphocyte and monocytes, they are agranulocytes. Agranulocyte and the cytoplasm of the agranulocyte. Look at that, the color is different. Hey, it is light blue purple color, not red color of the granulocyte. That is what you differentiate between granulocyte, agranulocyte. And so look at the cytoplasm. Cytoplasm is purple. One is purple, one is red. Very different. And look at the nucleus. Only one big nucleus occupying nearly the whole cell. That is lymphocyte. And you have seen the multiple lymphocytes in the blood film, which is leukemia. So now this lymphocyte cannot leave our eyes now because it is in the blue cytoplasm. It is the nucleus is nearly filling the whole cell. Big dark purple nucleus. That is lymphocyte. And monocyte is like a kidney bean shape. Kidney bean shape. So I want you guys to eat kidney bean this evening and think about monocyte. Yeah. So everyone eats kidney bean today and you think about monocyte, and its cytoplasm is purple as well, purple cytoplasm as well. Right, so let's look a little bit more detail. Yes, these are the granulocytes, neutrophil, eosinophil, basophil, and lymphocyte and monocytes. So I believe, it is pretty obvious for our eyes now, the hemoglobin, RBC, WBC, and how many different types of WBC we have, and what do they look like. So this is a little bit of functions of lymphocyte. Lymphocyte has got one lymphocyte will change to T lymphocyte, and another type of lymphocyte will become B lymphocyte. So that is what we have to learn in immunology. When we talk about lymphatic system, we talk about these lymphocytes. So this B lymphocyte means this lymphocyte came from the bone marrow, B, therefore it's called B lymphocyte, bone marrow, or T lymphocyte. So this bone lymphocyte have to go to the thymus gland, which is just in the upper end of the sternum. This lymphocyte has to go to the thymus gland and get educated and trained in thymus, and that lymphocyte is called T lymphocyte. So the lymphocyte which come out from the thymus is called T lymphocyte. The lymphocyte which just stay in the bone marrow and then finally mature and come out, it is called B lymphocyte. So these are the different functions. So B lymphocyte is good. B lymphocyte change into plasma cell when there is a problem, like when there is antigen or invading microorganism come in, and this plasma cell will secrete out antibodies. It will go and attach to the invading organism like bacteria, virus, antigens, and then that will neutralize, and macrophage will just eat all these antigen antibody complex away. So that is one way to solve it. So T lymphocyte, what they have to do is they have to go and attach to the antigen, invading organism, bacteria, virus. And then finally, it's just leave its arms and then just detach T lymphocyte. And that way start the lysis of the invading organism. So that is the basic of some immune system, which is carried out by the B lymphocyte and T lymphocyte. I hope you guys can stay for a few more minutes, because we do not have much to talk about. So we just carry on straight away, and then we let you go early. Yeah. So this is T lymphocyte and its function, and this is the B lymphocytes and its function. So B lymphocyte is from the bone marrow. They just produce antibody, B for antibody, go and attach to the invading organism, bacteria, virus, antigens, and then this antigen antibody complex will be cleared away by the macrophage. And the T lymphocyte, they have to go and attach to the antigen, and they just leave it there and then come back out, and then there will be lysis of the cell being attacked. So this is a slide. This is a slide from our textbook. So it's trying to explain, neutrophil, 3-lobe, eosinophil, bilobe, and basophil, very acharacteristic. There is no character at all. Lymphocyte, blue cytoplasm nearly filled with deep purple nucleus, and monocyte is like a kidney bean shape, blue cytoplasm. And how common are they? These are the neutrophils, very common. Basophil is just 20 to 30. And how many days do they live in our circulation? RBC, 100 to 120 days, and their lifespan is not important in detail, but I want you to have a general knowledge, like, hey, what is the lifespan of RBC? I want you to say 3-4 months. What is the lifespan of the WBC? I want you to say, hey, just a few days, like about 1 week. So that sort of knowledge. Yeah. So RBC, 4 months. WBC, 1 week. Oh, that's the big difference between red blood cell and white blood cell. And what about the platelets? Platelets, again, their lifespan is about 10 days. So 1 week, 10 days, and 4 months. So that's sort of stuff I want you to remember. I don't want you to remember like, oh, monocyte 2 to 3 days. So just like I want you to have a broad idea as a mature person. Like, you cannot remember everything in detail, but you know from a distance what's going on. Right, what about platelets? Platelets, as we said, it is like from the big piece of cheese, just grate it away, small little chips come out. That is platelets. So platelets is a fragments of megakaryocytes. So mega means large, karyocyte means cells, megakaryocyte means bone marrow cells, and then they are wrapped with the plasma membrane, like RBC. RBC means hemoglobin wrapped with the plasma membrane. So platelet is also a cell, which is a chip of cell coming out from the megakaryocyte. It's just fragments. And plate means, you know, a saucer plate, like a little flat shape. So like look at the shape of the platelets. It is like a little flat shape. What will you say? Small little cookies? Yeah, small little cookies or pancakes, small pancakes, look like small pancakes being piled. So if you go to McDonald's, you can get this similar shaped pancakes. So that is what it is look like. Its diameter is 2 to 4, which means even the largest platelets is just the half the size of the RBC, because the size of RBC is about 7.5 to 8, and the size, biggest size of the platelet is 4 micro. So that's the way you try to relate the size of each and within each other. Of course, with time you will forget about that, but when you read again, it just come back in your mind. So platelets, the size of the platelets is just about or less than the size. So RBC is might be 7.5, so about 4 times, 3 to 4 times bigger than platelets. So that's the way, you know, we try to relate each other. Does it really matter? Oh no, but if you know, it's better, isn't it? So what does it do? Platelets from the circulation, you know that you have the endothelial cells here, and you will see the pericyte, not seen, collagen fibers around the blood vessel. When there is a damage, the circulating platelets will gradually come and get contact with the collagen fiber. Of course, there are a few more chemicals which you will have to study in the physiology, like von Willebrand factors, and platelets will adhere to the collagen fibers on the damaged area of the capillaries, and gradually more and more platelets will be attracted and that will become a clot. That's the way bleeding, stopping the bleeding occur. Yeah, so that is the way to stop the bleeding. Look at the platelets. So in the fibrin fibers, you will see the chips of platelets being entrapped. So that is what happened. So collagen fibers, fibrins from the blood will come in, fibrin from the coagulation factor, and the platelets. So primary platelet plaque formation. So vessel injury, platelet come and grab there. That is the primary platelet. That will stop the bleeding to some extent. That will slow down the bleeding. So now you have seen properly platelet as well. And bone marrow. So all these blood cells like RBC, WBC, and platelets, they came from the bone marrow. So bone marrow, if you go and dig into the bone marrow, there are 2 types: red marrow and yellow marrow. Of course, yellow marrow for you and me, like at our age, we have more like yellow marrow. Why? There is more fat cell, and it makes the blood cell only when there is an emergency, like our big femur, shaft of the femur, diaphysis of the femur is not making any blood cell anymore. Might be the sternum or the pelvic bone, which is like a flat bone. Like it is. So red marrow is mature. It will have immature RBC, and then these red marrows will keep generating the RBC, and WBC. It makes blood cells actively, it is actively making. And where are these? So our sternum, which is the flat bone, it will make some, it will have red marrow and it will make blood cells. And the same thing like our pelvic bone, like you will see in the pelvis, the pelvic bones are flat bones. So the trabecular bone in between, one flat bone and another flat bone, cortical bone, come and sandwich like that, like our skull bone. So these trabecular bone in between two cortical bones, they are the sites of the red marrow. So our pelvic bones, they are the sites of the red marrow for us in adult. But when we were young, when we were babies, like children, or most of their bones are very actively and they have full of red marrow. But with time, gradually time, the aging change, and then this red marrow will be replaced by the yellow marrow. Look at that, our spine. We will see the spongy bone here in the center of the spine, vertebral column. So there we will get the red marrow. Sternum, our sternum will get the red marrow, and the pelvic bone will get the red marrow in adult. That's why hematologists, when they have to do bone biopsy, they will go into the pelvic bone. Yeah, of course, sternum, they don't want to go too often into the sternum, because if they miss it, they just go into the thoracic cavity, because behind the sternum, we will have the heart and the mediastinum, so we don't want that. So this is the summary of all of what we have talked about: red blood cell, white blood cell, and so from the hematopoietic stem cell, we will have lymphocytic stem cell and myeloid stem cell. Lymphoid stem cell will go into the lymphocytes, B lymphocyte and T lymphocyte. From the myeloid stem cell, we will have platelets, megakaryocyte, monoblast, myelofibroblast, and proerythroblast. So proerythroblast will become erythrocytes. So the origin is from the myeloid stem cell. Yeah. So now you start looking myeloid stem cell and lymphoid stem cell. So lymphoid stem cell will become lymphocyte, and the rest will come from the origin from the myeloid stem cell. Of course, the origin is hemopoietic, hemoblood poietic forming stem cells. From hemopoietic stem cell, two cells develop: myeloid stem cell and lymphoid stem cell. Lymphoid stem cell will become lymphocyte. The rest of the cell we talk about will come from the myeloid stem cell. This cell include platelets, other white blood cell, excluding lymphocyte and the RBC. And finally we get the erythrocyte, neutrophil, eosinophil, basophil, monocyte, and platelets here. So you can see like large piece of platelets, megakaryocyte, large karyocyte cells, megakaryocytes, little piece came out as the platelets. And B lymphocyte will change into plasma cell. T lymphocyte, we have effector T cells. Sickle cell, look at the normal RBC. It is a circular structure on one side. It's a biconcave structure. When there is a problem with sickle cell disease, their RBC, their hemoglobin has different amino acid change, and therefore their function is not very good. And the RBC, once there is low oxygen, hypoxia, then their RBC will change into this shape, like a sickle shape. So that is what we call sickle cell disease. So sickle cell disease is because the problem is in the hemoglobin. Hemoglobin change, instead of glutamine, one of the amino acid, glutamine, there is valine. Just because of these little changes, one amino acid, instead of glutamine, the valine amino acid came in, and this hemoglobin cannot function properly, especially when there is hypoxia, low oxygen in the body. Their hemoglobin, RBC, their RBC, instead of biconcave, they change into the shape, which is sickle shape. And that is what we call sickle cell disease. So that is the end of the blood lecture. So it is all about this slide. It is all about this slide. A blood, we will have plasma and cell. Cell will be RBC, WBC, and platelets. Plasma will be this. And don't forget the shape of RBC and few little things. Have you got any question?
No.
No, I think it is, because you guys have been having heavy lectures, like every day we have lectures. So this is pretty short and sweet lecture for you guys, I hope. But it is nice. It's plasma, difference between plasma and serum. What is the serum? Hey, plasma minus clotting factor. If we take out clotting factor, which is fibrinogen, then we'll get the plasma, and we'll get the serum. If we split the blood will be cell and the fluid plasma. And what is blood? Blood is specialized connective tissue. What is bone? Bone is a specialized connective tissue. What is cartilage? Cartilage is a specialized connective tissue. What is blood? Blood is specialized connective tissue, which is made of cell and matrix. Cells are RBC, WBC, and platelets. Matrix, blood is water-like fluid. Therefore, the fluid is called plasma. Inside the plasma, yeah, we have everything we need. Water, of course, is most important because it is fluid. So fluid need to be water. And serum, so serum means plasma minus fibrinogen. And centrifugate, that's what you are going to get. Blood is made of cell and matrix. Matrix is plasma fluid. Hematocrit, this little hematocrit definition is a little bit cocky. Try to hammer it. Hematocrit is a percentage of blood volume that consists of RBC. This is hematocrit. This is hematocrit, because hematocrit is important in your daily life, in your clinical practice. Low hematocrit, high hematocrit. Low hematocrit means there is low red blood cell. That indicates low blood cell, which means anemia. Draw a blood film, take out somebody's blood, put a little drop on the glass slide, draw a blood film and dry it. Just follow the standard operation procedure, SOPs. Just do what your lab asks you to do, and now you will see the blood film. The most you see RBC, because RBC contributes nearly 45% or 45% of cells, and the rest will be white blood cell and platelets. Platelets are so tiny, you might not be even able to tell that. And you will see the white blood cell. White blood cell, hey, how many types of white blood cells? 5. One is, the least common is basophil, isn't it? Banana, so basophil. So it is less than 1%, which means even if you see hundreds of other WBCs, you might or you might not see one basophil. So it's pretty happy not to see basophil because it is really uncommon. But what you are going to face is you're going to face a lot of neutrophils because it is most common, which makes about 40 to 60% of the white blood cell. Hey, too many white blood cell. It is like reaction to something, or is it leukemia? RBC target cell. Target cell, that's the same as your target. This is pretty lovely normal. Biconcave RBC, spherical WBC, and chip and pieces of platelets. You don't even say this is a cell. You know, it's you will say, hey, what is this rubbish? Hey, it's not rubbish, it's platelet. RBC, hemoglobin, RBC lifespan, WBC. Don't forget this granulocyte, agranulocyte, or never let monkey eat banana. Hey, this is very good diagram. Granulocyte, red, agranulocyte, purple, depending on their cytoplasm. ET, characterless, no character at all. Basal phase, therefore we don't want him. We don't want basal phase, so therefore it is less than 1%. Neutrophil, 3 lobes. Eosinophil, 2 lobes, ET. Lymphocyte, nearly filling the cytoplasm, the whole cell with little cytoplasm, which is stay blue. Kidney-shaped nucleus, kidney bean. So yes, blood is not difficult. I hope it wasn't too difficult for you guys. Okay. Right. So have an easy day and have a good weekend. Any question?